Greetings, doctors and evaluators. We are from Group B5, and today's presentation will be about basic pharmaceutical medicine and drug ethics. And here are the group members. My name is Dennis with the last three digit number 119. I'll read today's case in Bahasa Indonesia. Ibu Made, 25 tahun, datang ke praktik Anda mengeluhkan terdapat cairan kental dan lengket keluar dari vagina dan berbau amis. Hasil pemeriksaan ditemukan adanya duh putih atau abu-abu yang melekat di sepanjang dinding vagina dan vulva. Dari hasil anamnesis diketahui pasien memiliki bayi berumur 9 bulan dan masih aktif menyusui. Pasien didiagnosis mengalami vaginosis bakterial. Tuliskan resep untuk Ibu Made. Obat-obatan yang tersedia di tempat praktik Anda adalah sediaan tablet metronidazole 500 mg dan ovula metronidazole 500 mg. Tuliskan resep yang akan diberikan jika pemakaian adalah 2 kali sehari masing-masing sebanyak 1 tablet selama 7 hari atau metronidazole ovula sekali sehari selama 7 hari. Berikanlah KIE untuk pasien ini.
Good morning, doctors. My name is Neta with last three digit of student number 112. So from the case above, the patient is Made, female 25 years old, who has a 9-month-old baby and actively breastfeeding. Her symptoms is that there is a thick and sticky discharge coming out from her vagina and smells fishy. From the physical examination result, there is a white or gray discharge that othered along the vaginal wall and vulva. Based on her symptoms and physical examination result, her diagnosis is vaginosis bacterial, which is a condition caused by an overgrowth of normal vaginal flora.
Greetings and allow me to introduce myself. My name is Tracy Odala Geraldia Kema with last digit name number 115. The therapeutic objective for bacterial vaginosis is to improve and relieve the symptoms, also infection signs of the disease such as vaginal discharge, and also to minimize the probability of reoccurrence in symptoms. The patient should be given an education about vaginal hygiene and sexual activity to minimize the risk of reoccurring symptoms and to improve sexual reproductive health. The therapeutic objective is achieved by giving medications such as metronidazole.
Let me introduce myself. My name is Samantha Petrona Theobald with NIM 220251108. Tablet metronidazole will be absorbed entirely with bioavailability more than 90%, resulting in 8 to 30 mg per liter drug concentration in blood. Absorption of metronidazole topically is insignificant compared to orally administered. Bioavailability of a full administration estimated at 20 to 25%. Distribution of metronidazole occurs extensively in all over the body, including body fluids. Metronidazole in adults is distributed steadily with volume 1.51 to 1.1 liter per kilogram. Metronidazole, which is originally administered, will undergo first-pass metabolism in the liver, produce an active form of the drugs, such as hydroxymetabolite. Metronidazole is eliminated mainly by the kidney in the form of urine, about 60 to 80%, and metronidazole is also eliminated in the form of feces and unchanged drug. It takes about 8 hours.
Let me introduce myself. My name is Ida Bagus Tresnaendra Putra Pramana with the last three-digit number 104. For pharmacodynamics, metronidazole is an efficient antibiotic against some anaerobic bacterial infections. In vitro investigations suggest that metronidazole has no effect on facultative anaerobes or obligate aerobes despite showing efficacy against the majority of obligate anaerobes. Metronidazole's antimicrobial cytotoxic actions are most likely due to anaerobic organisms reducing its nitro group, causing DNA strain breakage in microorganisms. It is also critical to be mindful of the danger of metronidazole-induced peripheral neuropathy and seizures, particularly at larger dosages. If an individual has convulsions or numbness in an extremity, it is suggested that the medication process needs to be stopped right away.
Hello everyone, my name is Bernard Karel Koresma Fati, with the last digit of my student number is 103. So right now I will talk about the drug interaction of metronidazole. First, with alcohol. Consumption of alcoholic beverage or product containing alcohol or propylene glycol is not recommended while being treated with metronidazole. This can cause disulfiram-like reaction in some patients, including unpleasant symptoms such as hot flashes, throbbing, and headache. Next, with oral anticoagulant. Metronidazole may potentiate the anticoagulant effect of oral anticoagulant and increase the risk of bleeding. Patients taking oral anticoagulant should be closely monitored for signs of bleeding. Next, with lithium. Metronidazole can increase serum lithium level and cause lithium toxicity. Patient taking lithium should be monitored closely for signs of lithium toxicity such as tremors, confusion, and seizures. Next is disulfiram. Do not take disulfiram with metronidazole. It may cause psychotic reaction. Symptoms may include confusion, hallucination, and seizures. The last one is CYP 450 enzyme inhibitor. Metronidazole is metabolized by CYP 450 enzymes. An inhibitor of this enzyme may increase serum level of metronidazole and increase the risk of side effect. Patient taking CYP 450 enzyme inhibitor should be closely monitored for sign of metronidazole toxicity.
Greetings, doctor. My name is Gabrielle from your Staffy Towers in numbers 118, and today I'll be explaining about metronidazole ovules. Metronidazole ovules 500 mg are specifically designed for intravaginal use to treat certain vaginal infections such as bacterial vaginosis. Metronidazole ovules are typically small, bullet shaped that are inserted into the vagina using an applicator. This drug have various advantages, including first, convenient and easy to use, second, localized treatment for vaginal infections by directly delivering the medication to the vagina, third, effective against specific infections such as bacterial vaginosis, and less reduce systemic side effects since the medication is delivered locally. However, this drug also have various disadvantages, including first, this drug are not effective against all types of vaginal infections, only for bacterial vaginosis, and second, they can cause local side effects such as vaginal irritation, itching, and discharge. Third, due to their localized nature, metronidazole ovules may have limited systemic absorption, and last, this drug are prescription medicines, so can only be obtained with the healthcare provider's prescription. I think that would be all from me. Thank you.
Okay, so my name is Fairuza Husni Adipa with real last digit of student number 102. Next. Okay, now I'm gonna explain about the drug dosage regimen. So the first one is active substance and dosage form. So the effectiveness, the oval one was more effective than the tablet because it acts locally in the vagina, but the tablet one is more cheaper. And in terms of safety, both actually safe for breastfeeding, but the oval one, it can reduce the exposures of the metronidazole to the baby. And the standard dosage for the tablet, it is twice a day, one tablet, and the effectiveness was it can contribute to the patient less compliance, and the safety, alcohol should be avoided while using this drug. And the oval one, the standard dosage was once a day, one oval, and the effectiveness was it can be inconvenient when administered because it has to be inserted in the vagina, and the safety was the same, alcohol should be avoided while using this drug. Next. So now for the durations of the treatment. So both of the drug has the durations of 7 days and it has to be finished as prescribed. And the effectiveness was the oval root is cost more than the tablet. And the safety was the side effects are nausea, vomiting, the metal taste of the breast milk, etc. And if the symptom is worsened or not disappear after 7 days, the doctor should be notified. Therefore, based on the consideration, the drug that is recommended for the Ibu Made is the metronidazole oval because it may cost more, but it is safer for the baby and it is even more compatible with breastfeeding. That's all from me. Thank you.
Okay, thank you for the opportunity. My name is Valentin Chandra Wijaya with related digit of the number is 1 I will explain about the prescription. First of all, at the top of recipe, there is the prescriber identity, which contain the name of prescriber, and then address, and then SIP, and then telephone number, and then the mobile number. And then there is the date and place of prescription, which is Denpasar, 28th of May 2023. There is a superscriptio, which contain the ra simple, which mean the recipe or ambillah in bahasa. And then there is the inscriptio containing the name of drug, which is metronidazole, the dosage form, which is ovules, the dose of drug, which is 500 milligram, and the quantity of drug, which is 7 ovules. And then there is the signatura, which means how to consume this drug. This drug is consumed before going to bed, once ovules, once a day, and through the vagina. And the last is the patient's identity, which contains the name of patients, age, body weight, and address. Thank you.
Opportunity. My name is Kevin Atana. Last 3 digits are 105. Duration of the treatment can be examined defined by using AMSEL diagnostics criteria, which is the most common examination. After the examination shows negative results, the treatment can be stopped immediately. Clinicians must also be aware of the recurrence of the disease. The recurrence can be caused by residual infection, resistant, or reinfection. The recurrence can be treated by antibacterial within the guidelines. Other than that, several treatments can be used for recurrence, such as probiotics, vitamins, and herbal treatment.
Greetings, my name is Justin Kinadinta Santosa, and I'll be the one bringing you the first part of communication, information, and education. Alright, so the next part after educating her about the disease is informing her of the medicine we're going to give her. So, Miss Made, in order to cure you, I'm going to prescribe you an antibiotic called metronidazole. So metronidazole itself is available in two different forms. You can choose between tablet form and ovule form. So for the tablet form, you have to consume it orally twice a day after meal for 7 days. You gotta make sure you finish all the medicine, otherwise you're gonna get sick again and possibly become resistant to the antibiotics we give you. Which means that the next time you come, or if the disease should recur, well, you might need to take a different antibiotic that could cost more, or there's a possibility that no antibiotic will work to cure you anymore. So the advantages of tablet form is its price. It's relatively cheaper than ovule metronidazole. However, there are some things you should consider. Alright, so the next part after educating her about the disease is informing her of the medicine we're going to give her. So, Miss Made, in order to cure you, I'm going to prescribe you an antibiotic called metronidazole. So metronidazole itself is available in two different forms. You can choose between tablet form and ovule form. So for the tablet form, you have to consume it orally twice a day after meal for 7 days. You gotta make sure you finish all the medicine, otherwise you're gonna get sick again and possibly become resistant to the antibiotics we give you. Which means that the next time you come, or if the disease should recur, well, you might need to take a different antibiotic that could cost more, or there's a possibility that no antibiotic will work to cure you anymore. So the advantages of tablet form is its price. It's relatively cheaper than ovule metronidazole. However, there are some things you should consider. For ovule metronidazole, you should put the medicine into your vagina once a day, every day, before sleeping for 7 days. So before you use the medicine, make sure you already clean or wash your hand and your vagina as well. Although this form, the ovule form, is more costly than the tablet form, it causes fewer side effects and is more effective at curing you. Although you may feel uncomfortable when taking this medicine. So that would be all from me. The next parts will be explained by my friend. Thank you.
Hello, my name is Natasha Pramatia Putri with student number 2202511111. I suggest you to take thiophyl metronidazole. Even though it is more expensive, it is more effective and causes less side effect. You should be aware of allergic reaction that may happen during this medication, such as rash, itching, dizziness, and difficulty of breathing. If the side effects bother you or they persist, then please contact me and we'll discuss further plans. There may also be serious side effects such as the whites of your eyes turning yellow or skin turning yellow, sudden infection, ulcers, bleeding, brushing, extreme fatigue, extreme stomach pain, blurred vision, and double vision. If you do find yourself experiencing this side effect, please call me right away or call emergency services. So that's all from us. Thank you for watching.